Hello, everyone, and welcome to What You Missed in History class. Woo! So before we get into it, I would like to introduce you to our team. My name is Lasperma.
My name is Melissa.
I'm Michelle.
I'm Stephanie.
And now I'm going to tell you guys a story. So imagine a time where people are panicked. Everyone is dying because of a disease that nobody knows about. Everyone is wearing masks. Businesses are literally shutting down.
About 2020 or 1918?
That's right, Melissa. Today we're talking about the 1918 flu pandemic. So now, what is it called? I mean, it's 1918 flu pandemic, right, Melissa?
Yeah, but it's also called as America's Forgotten Pandemic, or they also call it the Spanish flu, even though no one really knows where the virus originated from. So the reason why they call it the Spanish flu is because like other presses weren't willing to cover the virus because this was during World War I, but Spain was the only nation willing to cover it because they were neutral. So that's why they associate it with Spain, even though that has nothing to do with where its origins are from.
And if you think about it, if they were the only ones to want to cover it, then they're the ones with the higher numbers, right? So they think that people from there were impacted stronger, even though they were just covering it like nobody else was.
Yep.
So that's actually really smart. And what were the symptoms of the flu?
Okay, so some common symptoms were fevers, chills, basically like normal flu. The only difference was that people would get their skin would turn blue and their lungs would fill with fluid, preventing them from breathing, and they would suffocate. If you got someone had the virus and you were near them, it was contagious, so you wouldn't know you had it, but within a few hours or days you would pass away.
You would just immediately pass away.
There was no cure.
I mean, I don't know why I laugh when I'm nervous, so let's just take that out of the record.
In order to slow down the virus, people started wearing masks, sanitizing more, self-quarantining, they shut down businesses, movie theaters, transportation trains, and stopped giving out library books to prevent spreading germs. And even in San Francisco, they were charged $5 if anyone was caught without a mask, and they would be charged with disturbing the peace.
I feel like that's what we should do now, you know? Yeah, but it's crazy because even though they did all of that, the death toll was still from 20 to 50 million people, and that's only an estimate, so it can be higher than that, and some people actually believe it was up to 100 million people who died from this disease. And if you put it in the medical perspective of how the medicine field was at the time, it gets even crazier because they didn't even really know what to do. It's actually kind of curious how the death toll wasn't higher, because all that the medical people, like doctors, everything that they could actually do was just hydrate their patients, tell them to go on bed rest and so on and so forth, because they didn't even have much to work with. I mean, penicillin hadn't even been invented, right? And even though penicillin doesn't work on viruses, it does work on bacteria, and it could have helped with the bacterial pneumonia that came for some patients after the flu. And even further than that, you didn't even need an actual medical degree for you to practice medicine. It was just that you went and you practiced medicine, right? It wasn't that now you have to go through almost 15 years of training and so on and so forth. So some crazy stuff.
That many medical professors that were in the U.S. because a lot of them were deployed in military camps. So the number of nurses was down in this country. So it was terrible when this pandemic hit because there was not a lot of medical professionals here in the country to help with it.
Right. So it wasn't really focused on civilians, right? Only military personnel. Yeah. And some crazy facts that I stumbled upon while I was reading about it was that it didn't really killed most of the 75 and over Asian population or the younger. It killed specifically those from 20 to 40 years old. So those with the stronger immune systems, those are the ones who would pass away. Whereas those with weaker immune systems, somehow they would live. And I thought that was crazy, right? You would think that those with the weaker immune systems would be the ones to pass away.
Right, and something that I found was, first I want to make this comparison about Pennsylvania. So in Philadelphia, right, they had this parade called the Liberty Loan Parade. And
The what?
Liberty Loan Parade. So it was like a celebration to celebrate government bonds, right? So,
All right, the war.
Yeah. So these medical professionals at the time were like, it's okay to go out. And so they had this parade.
Mhm.
But as a result, 12,000 city residents died. So as you can see, it wasn't as safe as they thought it would be.
Right. And that sounds strangely familiar, Michelle.
I was reading how the life expectancy in the United States because of the flu, it went down by 12 years. And now imagine how much it went down worldwide. And for me, one of the things I found really interesting, because so many people were dying, there was actually a shortage of coffins and grave diggers. So it's just like people were dying and they couldn't really bury them, because where could you bury them if they don't even have the capacity to even do so? So I feel like that was really interesting.
Would they make like mass graves?
Yeah.
Yeah, that's so sad.
Mm-hmm.
And it made it even more unsanitary when like they're trying to keep everyone safe and clean with all those bodies around. So that like made the situation even like more hectic.
Yeah, I feel like, yes, definitely.
Okay, and because there's no cure, like what I found was an interesting fact was a lot of people got aspirin poisoning because medical professionals would advise people to take up to 30 grams a day, which is very toxic today. So a lot of them would get sick with the pandemic and that, so it leads to even more death. I found that very interesting that medical professors would advise that to their patients.
And that puts into more perspective of how little they knew, right? Like, you're poisoning your patient, but they didn't know. They actually thought they were doing right. So that's some crazy stuff.
And adding on to your earlier question about mass graves, so there is one in Alaska in a village that used to be called Revig Mission. So what's very interesting about this is that Johan Holten, he's a Swedish microbiologist. He was 25 years old, and in 1951, he went to collect tissue from the past, from the corpses that died from the virus, right? So he was actually able to recover lung tissue from one of the victims, and he brought it back to be tested on, and they were able to kind of piece together what made this virus so deadly.
I feel like that's some quality information to get, because even now we don't know where the virus came from. Like, we have no idea where it originated or how it originated. So, being able to get those samples from a corpse that was basically frozen, because it's Alaska, right? So it makes everything, way better, and it gives you a very particular look back into the past.
I feel like when you hear all of this, it can get really overwhelming, because you're you're reading and hearing so much about death that it can I feel like for doctors it can definitely take a toll on you, even survivors and those of the relatives of those who passed away. And I was reading how there was basically not a lot of newspaper articles about the personal stories of people who died or survived, because it was just really that sad. And I was also reading this quote about this doctor named Victor Vanghan, and he was talking about how he didn't even want to write about it in his book, because it said that no matter who you were, they affected you. You were a soldier, civilian. It didn't care, because that's just how the flu works. It doesn't target a certain ethnicity or anything like that. It just affects everyone.
building on to what you said about how like it targets anyone, there has been a lot of people that, this virus, the 1918 virus, is referred to sometimes as the Spanish flu. And some people call coronavirus the Chinese virus. So what would you tell those people? Why isn't it okay to do that?
It's not okay to do that because when you associate it with a certain like ethnicity, then that creates racism within like other people, because now they're gonna have like a scapegoat, be like, oh look, because you're from this country, you're the problem and stuff like that. And I feel like that just leads to more racism.
Right, Melissa, I agree with you. It gives people a target, right? Someone to blame for the ongoings and the circumstances right now. So it's definitely very important that we're politically correct in, calling the virus for what it is, which is COVID-19 or coronavirus, since it's nobody's fault that this actually came up.
Information like everywhere, so it's very cautious to be aware of what exactly you're associating it with,
I completely agree, Stephanie. Very important to be aware and to spread awareness, right? Mm-hmm. Not only to be aware ourselves, but also to tell everyone around us that they should not be targeting a specific ethnicity because of anything of the sort. And Melissa, what was it that you were telling me earlier that they did with the masks back in 1918?
So back in 1918, so that there were like a lot of ordinances saying that you have to wear a mask. So for people to get around with it, what they would do was that they would poke holes in their masks so that they would smoke. So that completely defeated the entire purpose of you wearing a mask. If you're like covering your particles.
Why are you covering your face if it has holes in it? And I was actually reading this other article, and it said that they shouldn't even be wearing masks in the first place because viruses are too tiny and they're gonna get through the masks. So that also brings into perspective how little they knew as well. And now that we're talking about all of this, I've been seeing the similarities between coronavirus and our time now as with our time back then, and it's surprisingly striking and crazy how even with the same, we have the same regulations, and you're supposed to learn history so that it doesn't happen again, right? Mm-hmm. So we had everything with the flu pandemic back in 1918, and you would think it would make people like more lenient towards wearing masks and towards, staying socially distant and so on and so forth. But even now we're seeing people protesting because they want to be able to not wear masks, or all these videos of people going into stores and actually being rude towards the staff just because they don't want to wear masks when entering. And it makes me wonder, why don't they want to do that? Why don't they want to wear a mask if it's going to protect them and others? So what do you guys think the answer to that is? Why are people so intent on not just following the rules so that everyone can be safe, even when this has happened before, right?
I think it mostly has to do with the fact that some people really are selfish, and once they heard that masks are meant to, if they have the virus, it's supposed to help them from not spreading it. So technically, they're supposed to be doing it for others, but once I feel like that is what
for Michelle, you can
yeah, that is what is causing people to not wear the mask. And also there's also a lot of political figures who are encouraging people not to wear masks, so I guess that also has to do with it.
Right, because if you look at your political figures, you almost look up to them as, like the person with respect and the authority to guide you, right? So if they're saying not to wear a mask, then I guess it makes you less lenient towards actually wearing it, which is why it's so important that we choose, leaders that actually know what to do in these situations. What do you think, Melissa?
Yeah, I definitely do think that political figures do play a role in people not choosing to wear a mask. And I feel like we have to bring back this notion that, you know, back then people would wear masks because, you know, it was during World War I and there was a flu. And so people associated you wearing a mask with something you should do because you're a citizen and a resident. And basically that's just something patriotic that you should do. And I feel like definitely like today we need to instill that value that you wearing a mask is patriotic, because that just shows how much you care for the lives of others rather than
In
just
your own country, right?
Mm-hmm.
I agree with you, Melissa. What do you think, Stephanie?
I also think you guys made great points, and I agree with all of them. I also think it has to do with people wanting to suppress their fear of like what's happening in the world right now. Because I think if they are trying to avoid wearing masks, they're avoiding the problem. They're not admitting that this is a very serious and deadly issue that is affecting all of us, not just certain people. So I think they just want to make it seem like no big deal because they don't want to admit what they're feeling about it and everything like that. And I also think the politicians, we should be listening to more medical professionals, you know, not politicians who have an opinion on it, the people who are actually experiencing it and the people who are actually seeing it every day in their working lives, you know.
Absolutely, Stephanie. And that just brings back to me the whole idea of learning history so that it doesn't repeat itself, right? Because even back in the past, in 1918, the government and the medical field, they were both working together to like downplay the flu virus. And they really weren't like, you know, like very much like methods of communication between each other people, because the phone had been invented, but it was still extremely expensive, so not a lot of people had access to it. But what they did have were telegraphs, right? So they communicated with each other, and they tried to spread the word that the virus was not actually so deadly. But as we can see, as an example that Michelle gave us, I mean, 12,000 people died because of a parade, just one parade, and that amount of people died. So it's crazy to think that it happened back then and that they can't even see, you know, like, it makes me so frustrated because it's like you're supposed to follow the rules so that everyone is safe. Why would you not want the safety of yourself and those around you, you know? It's incredibly frustrating. And even now with coronavirus, guys. And another thing is that, you know, the flu, they actually never found kind of like a cure for it when it was on like in such high amounts during the 1918 and 1919. They didn't actually find any way to treat it other than, you know, hydrating, bed rest, and so on and so forth. Until 1940, when it had actually like lowered down. That's when Jason, I believe, what is the name? It was Jonas Salk and Thomas Francis, until they found a vaccine for this particular strain of the flu virus. And they were able to, you know, spread it to people and help them out. And I thought that was really cool that Jonas Salk was in it, because he actually also invented the polio vaccine. So I thought that was actually really cool that he also helped with the flu vaccine. And then they found that there were different strains of the influenza virus, like influenza A and influenza B. And so they went on updating the vaccine as much as they could as time went on.
Crazy how long it took to actually come up with like a vaccine and immunity.
Right? Like 20 years.
Because
and by that time, the Second World War has started, you know? So they actually gave it first to military personnel rather than civilians.
And that's why it's important to learn from history, because you see how long it took for a vaccine. Sorry, guys. That's why it took so long for a vaccine to like be made. The same thing could happen with COVID-19. So that's why it's important that we protect ourselves and we wear masks and we wash our hands, because we don't know how long it'll be until we find a vaccine.
I feel like it's definitely going to be a shorter amount of time than 20 years though, because of the advancement in medicine. But I definitely agree with you, Michelle, because the actual truth is that even though I'm making that assumption, we don't know, right? Like, so we have to make sure we protect ourselves and those around us.
Doing your part and doing what you need to do goes a long way, even if you don't see it automatically. So just keep following regulations, health regulations. I agree with you, Michelle. Keep doing that.
Yeah, for sure. You know, like as a reminder, back then they all like they social distance. We social distance now, and then although like at times it may feel like we're not together, we are together. We're all living during times of uncertainty. But I know we're gonna. If they could do it back in 1918, then I know that we can do it too. So yeah.
And that's another thing, right? That they got through it back in 1918. They were able to, overcome the virus. So it's important that you remember that just like they were able to overcome it, we are going to be able to overcome it as well. Mm-hmm. And in the end, everything's going to be fine and the sun is going to rise again, and I'm going to stop being corny now. But yeah, it was just important to let you guys know that, you don't only look at the negative aspects of history, but also the good ones where people actually overcome their setbacks. And I believe that is our time limit, guys. So it was a pleasure being here to talk to all of you about this crazy virus and about our current crazy virus.
Stay tuned for our next episode.
Yes. See you guys.
Bye.
Bye.